Hello, viewers. Welcome to Doctor's Health Talk Show. My name is Dr. Farhan Tahir. I'm a rheumatologist in Philadelphia. And today it is my pleasure to welcome my close friend, Dr. Benjamin Chu. He's an orthopedic surgeon in Central Montgomery Orthopedics and would like to know more about him and his life. So Ben, welcome. How are you?
Great, Farhan. Thanks for having me. I appreciate this opportunity to talk with you.
Ben, it's been my pleasure to know you for at least 9, 10 years. I think I started working at Lansdale and we became friends very quickly. But this is a unique opportunity for me to ask you questions I haven't asked, although I've seen your CV many times, but it's more fun to hear from you. So thank you for taking the time in your busy schedule. And our surgeons are by and large very busy people, and orthopedic surgeon even more. So we appreciate every second and moment of your time. And
Thank
with that, I would like to ask you a few questions that help us motivate other people to become physicians, because the purpose of this talk is who are my healthcare heroes? You are my healthcare hero. You put yourself out there to serve the needs of people. And no time other than this, COVID-19 has made me realize how valuable my colleagues are, my friends are. So again, thank you for all what you do for our patients, for our community in Bucks County, Montgomery County, and Greater Philadelphia. So let's start your choice of this profession as a doctor. Why did you become a physician?
Yeah, that's a very good question. I never had a very strong role model growing up that was a physician, in my family or neighbors. So I think as a result, my parents and I always looked up to physicians with very high regard. Obviously, they study for a long time. They work hard. They provide a service that can be relatively specific. So it was always a really admirable profession. And as I, went through schooling, I was naturally interested in sciences, especially biology. So that kind of paired well with studying medicine. And because of that great respect that I had for physicians, I always was chasing that goal, and fortunately was able to, pass all the hurdles and eventually, make it to medical school and graduate.
Very interesting. So, being raised in a family where there's no doctor itself. My parents always, similarly to your parents, looked that one of their sons should become a physician. When you said you were growing up, where did you grow up? In this area or?
Not too far away from here. Yeah. So I grew up in central New Jersey, primarily in a town called Warren Township in Somerset County, not too far away from Rutgers main campus in New Brunswick. So from where we are now here in Lansdale, Pennsylvania, only about an hour and a half from here, and very similar suburban environment, similar to how we're not too far away from Philadelphia. Now, where I grew up was not far from New York City. So very similar area as far as, the housing developments and, having to drive around everywhere because, there was some public transportation, but it wasn't easily accessible.
Easily accessible, yeah. And what was your choice of medical school?
Yeah, I went to medical school in New Jersey. At the time, it was called UMDNJ, University of Medicine and Dentistry, New Jersey. There were two main branches for medical school, osteopathic. One was in New Brunswick, which was probably the better recognized of the two. I went to the one in Newark, so UMDNJ, New Jersey Medical School in Newark. And recently, all of the UMD UMDNJs have been rebranded as Rutgers. So now I'm an alumni of Rutgers.
Rutgers, which is a great, well-recognized, well-respected school. So I want to say that, so the medical school life, did you make up your mind to become an orthopedic surgeon during that time, or was it
Yeah, it was during medical school. Up until that point, my exposure to orthopedic surgery was relatively limited. I was fortunate as I was active growing up. I never had any major injuries, so I never had to experience, from a patient standpoint, an orthopedic surgeon or other surgeon. And then there were some, occasional interactions, but it really was not until medical school that I had the opportunity to learn more about orthopedic surgery specifically, and then meet some orthopedic surgeons and orthopedic surgery residents. And those people were really influential in sort of showing me, they really enjoyed what they did. As I got more exposure, I found myself liking it more and more and more.
Well, Ben, I have to tell you a personal note that I have an immense thankfulness, and I owe a lot of gratitude towards orthopedic surgeons. I was born with club feet. And when I was little, I can't recall anything, but I was between maybe 1 to 3 years of age. At that time, I had these surgeries. And I'm able to walk and have a normal life, can play sports, all because of a surgeon like you. So I am extremely thankful for this profession, because if it was not because of those good, experienced, and kind-hearted surgeons, my life would have been quite different.
Yeah, wow. Yeah, I never knew that about you, Farhan.
Yeah,
So,
yeah, it's something that I wanted to tell you, that whoever inspired you, that's true, exactly. And my becoming a physician was similar story like that. So orthopedic surgery, neurosurgery, they're competitive. What was it like to get into residency, and where did you go for residency?
yeah, I did my residency at University of Michigan in Ann Arbor, Michigan, and it was extremely competitive. There are not too many orthopedic surgery residency positions available in the United States, and I think it does attract a lot of very motivated, very highly qualified candidates. So the application process is extremely competitive. I think in the end, it works well because once you're accepted into a program, you've got a very high chance of success because you are well qualified, and the programs have a lot invested to make sure that you learn what you need to do, learn what you need to learn, and are able to function well when you graduate. It was competitive, but at the same time, also, it's rewarding. It's part of the process.
Well, Ben, now I know why do I like you so much. We both went to University of Michigan at some part of our lives.
Yes,
So
yes.
I went for my fellowship, and
Yes.
that's why I was like, why do I like this guy so much?
Yeah, the rheumatology program at University of Michigan, excellent.
It's excellent. Thank you so
Yes.
much. And I have to say that the University of Michigan is a place where you can, it's very, it could be tiring, grueling. The residency program must have been, because there were times where I was like, this fellowship is so hard. But residency is always harder than the fellowship. So I can see how grueling and how hard training is, but it must have polished you and your skills and your confidence level, because every patient that we have ever shared, they always loved you, how you treated them, and your expertise comes in, they always feel so comfortable after what you have done to them. So,
thank you
for their surgery.
Yes. And you as well. So we can both thank University of Michigan.
University of Michigan, go blue. Good.
Yes, absolutely.
Yeah. All right. So What was your training like? Is 4 years orthopedics or 5 years? I forget.
Yes, it was a combined program, so 5 years total. The first year being during internship year, more general surgery, and some other specialties like ER, and then 4 years of strictly orthopedic training.
So what things from orthopedic surgery residency do you recall and you're like, thanks God, I don't have to do them anymore? There's some parts of our residency that we
Right.
had to do, but didn't like.
Yes, yes, yes. So there's definitely some, less than ideal memories of residency. I think the two that would sort of stand out in my mind were we had a very strong pediatric orthopedic program.
Okay.
Some very well-recognized professors, and the least enjoyable part of being a part of the pediatric orthopedic rotation was doing changes of hip spica casts, which we were using regularly to treat hip dysplasia. And the casts are oftentimes on for, months. And
Wow.
with young patients, there's it's hard to cast around the hips without getting the cast soiled. So we would have to change these casts that didn't smell too good.
Yeah.
Sometimes, in the summertime, sweat. So it was not a pleasant experience from a nasal standpoint.
My mom used to tell me that I don't know up to what part my plasters or what casts were, but yeah, she used to say that she had to like protect them for the same reason. So that's very interesting. Thank you for
Yes.
being so honest.
Yes.
Okay, so we are gonna ask you a little bit about your. Everyone develops an interest in within their own field. So in your fields of orthopedics, what did you got attracted to or gravitated towards?
Yeah. I specialize in what's called orthopedic sports medicine. And that primarily involves injuries to the shoulder and the knee. Mostly injuries to the soft tissues, so muscles, ligaments, cartilage. I was drawn to that for a couple different reasons. One, I was always active as a child growing up, so I enjoyed participating in different sports. I enjoyed watching sports. I was never very good at any of them, but I enjoyed it. I didn't have any injuries, fortunately, but injuries do occur in those in those activities. So I I found that I could relate well to patients who were doing those things and sustained an injury. And I also got a lot of satisfaction in helping those patients recover from that injury and get back to doing the things that they love doing. That was sort of the first major factor in that specialization. The second was I had a lot of really excellent role models that early on, allowed me to, get involved in treatment. So even when, as a second year resident, I really did not know anything, I was able to participate in non-surgical and surgical treatments. I felt included. There's a very much a team approach between not just the physician and the patient, but oftentimes physical therapists or athletic trainers that are involved in the care. And I enjoy that aspect of coordinating with other members of the team with a common goal in mind.
Very interesting. It's very inspiring. I have gathered from what you have said that you have taken your mentors very seriously, and you have used that opportunity to keep your focus and continue to push yourself to be even a better surgeon. So for the sake of my interest and audience, I'm going to ask you for sports, and you tell me the most common injury that orthopedic surgeons see it with each player. So
Okay.
just to gain interest, so let's say baseball.
Yeah.
What is the commonest injury in baseball?
Uh, the most common injury would be shoulder injuries, specifically the muscles called the rotator cuff muscles,
Hmm.
because baseball is a sport that involves a lot of overhand throwing, whether that's pitchers who are doing that, high repetition, very, very high velocity, or even a player in the field is still doing a lot of that. When you think about all of the practices and warm-ups and games, the wear and tear impact of that repetition is pretty significant.
Yeah, that's right. I have to say that one thing that is very unique to the American culture is the introduction of sports at an early age and how dedicated
Yeah,
parents and players are.
yeah,
I grew up in Pakistan, and we had cricket and
yeah,
hockey as their squash as their, but people never thought about injuries of sports because it was on and off. It was not as consistent as in American culture is.
yeah.
So that's a rotator cuff injury is absolutely right. And football. What is the commonest injury in football?
Yeah, football has a wider range of injuries, but I would say that the one that I would want to highlight as being, relatively common would be more ligament injuries about the knee. The two most common ligament injuries would be injuries of the MCL, the medial collateral ligament, and the ACL, the anterior cruciate ligament. And they have different impacts. Unfortunately, the ACL injuries are a lot more significant because they don't recover, whereas MCL injuries many times can recover, but there's time for the healing and the rehab
Yeah.
involved. Ligament injuries at the knee for football.
Um, I have an interesting question. I'll ask it later, but let me ask you about basketball. What is
Yeah,
the common injury?
basketball is such a demanding sport. The athletes in basketball are incredible. Um, they're subject to some of those same knee injuries that the football players are prone to, but much more common would be ankle sprains for basketball players because of the stopping and the starting. There's more likelihood of rolling ankle, and then unfortunately, jumping up and then coming down. If somebody else's foot is underneath yours when you land, that's a time where you're at risk for, sustaining a twisting injury to the ankle. So ankle injuries are extremely common, and, that's, at a certain point, those athletes have, a lot of repetitive trauma that builds up throughout their careers.
I'm listening to that one very carefully. My 14-year-old is in his middle school basketball team, and I'm really excited about him, but I worry about that and injury. So thank you for sharing that. Now, there is a winter sport,
Yeah,
and we recently had a friend that you consulted, and they loved you. It was an ice skating injury, a
yeah,
skiing injury, I'm
yeah.
sorry, skiing injury.
Yes.
So, what kind of injuries do we see in skiing?
Yeah, skiing, because it's such a high velocity, some of these downhill skiers are going, 50, 60 miles per hour, just, as amateurs. And, the ski slopes are crowded. It's not like a professional where they can, have the whole side of the mountain to themselves. The the injuries that I think that I would want to highlight for the skiers would be fractures, especially like collarbone fractures from the falls and hitting, being thrown off balance, falling forward, and landing directly on the shoulder, and that force creating a fracture.
Interesting. Yeah. Um, I want to ask one more sports question. I
Yeah,
do not know that I'm interested in sports that much, but as you're
yeah.
explaining so well, my curiosity is growing. So I see sometimes surfers on the beach.
Okay.
Uh, is there any water sports injuries? Do you ever see?
Uh,
Or twisting maybe ankle would happen?
In this area, it's not as common, but there are a lot of patients that travel to the New Jersey shore for the weekend that are involved in water sports like surfing or windsurfing.
Yeah.
And then, on the lakes that are not too far away, then, water skiing type injuries. I
I
want to
feel like
say,
that it's not as common, right? It's because the game is not as competitive and not maybe as
right,
vigorous.
there's not as many participants, so the number of patients is going to be lower. And I think from a organized competition standpoint, it's less frequent. They exist, but it's not like, say, every high school has a football team. Every middle school has, a basketball team. So the availability to participate in those sports is a little bit limited. Um, um, I would say, I don't know if it's the most common injury, but one that I would want to highlight would be sort of touching on an area that we haven't discussed yet, especially with like um, uh, wakeboarding, or water skiing, where you're getting pulled behind. We start to see some injuries at the hand and the wrist because of having to hold on to the tow rope. There's a lot of twisting injuries that can occur to the upper extremity.
Interesting. Well, I'm gonna focus on life of an orthopedic surgeon. Surgeons are known to get their day started early on. How is a typical day for you?
Yeah, I would divide the days into two categories, because as surgeons, we love to operate and do surgery, but at the same time, we also spend a lot of time in the office, providing consultations, evaluation, and also providing non-surgical care. So those days tend to be much different than the OR days. So the OR days do typically start a bit earlier. So most ORs, the first surgery, we want to be starting the surgery at 7:30 a.m. Some surgery centers are even moving that to 7 or 6:30 a.m., which means, as the surgeon, I'm getting to the facility early, but the patients are even there before me.
Yeah.
Um, and so our days may be starting at 6:30 or so that we can start the surgeries on time. And most of the times that day in the OR is one of our most enjoyable days, because if we can do multiple surgeries, then we can be in one place doing the thing that we enjoy doing, and there's a little bit less documentation. If you end up seeing 20 patients in the office, that's a lot of documentation. If I end up doing 3 surgeries, yes, I have to do some documentation, but it's 3 operative reports versus 20 office notes.
And you have created, repaired, fixed, and you have some sort of instant achievement right there.
Right.
Um,
Yes.
um, I always, and I want to share this with young people who want to be orthopedic surgeons or go into this field. A lot of surgeries are now using robotics and other things, and arthroscopics or minimal surgeries.
Yep.
What is the current trend in orthopedic surgery?
You're absolutely right. There's definitely a movement to try to improve surgical results, postoperative pain, other risks, trying to do more minimally invasive surgeries. So arthroscopic surgery is commonly used for the sports injuries that I treat. The shoulder and the knee being the most common, but now that's being extended a lot more regularly to the hip, which is another area of injury that can occur with a lot of different activities. minimally invasive surgeries have been really pushing pushing the advancements in care, because then whether it's for, say, the knee, like a knee replacement, or spine surgery with a less invasive approach, there's less muscle damage, which means that the patient's function can return sooner, so we can get that patient started in therapy earlier and maybe be a little bit more aggressive with the therapy. And that minimizes how much time that patient is in bed, with risks of other problems of being immobilized. We can get that patient back to work sooner, back to the activities of daily living, and that improves their quality of life. So minimally invasive surgery then has sort of evolved into trying to improve minimally invasive surgery. Some of that has now involved robotics or navigation, where there's guidance from imaging to improve, so we don't have to see it as much by making a big incision. We can make a smaller incision, but still see and feel what we need to using some of this computer-generated information.
Well, Ben, these are very interesting information, because most people, as your patient population is sports related, they want to go back to sports. Even now, people with orthopedic surgery, like joint replacements, I see them, they want to be up and around. They want to get going. And those days where we used to have like 3 months of recoveries, those days are gone. Right. People want to be moving like in 4 weeks, be back to their life. So that's definitely challenging, and thanks for your services of how you guys doing and improving the surgical techniques. What is your dream procedure, dream job? What is the best part of your day?
Yeah, I think I definitely enjoy the surgeries. Just like what you said, we get a lot of instant gratification of being able to see something that's a mechanical problem that we can then immediately change for the better. We don't always know what the final result's going to be, but there is a lot of instant gratification that the patient's going to do well if we perform a technically elegant procedure. I would say of the surgeries that I enjoy treating the most, partly because I think they're the most challenging, would be rotator cuff tears, like what we talked about earlier with the overhead athletes. I think for several reasons. The first is that those types of injuries can be very painful. So, patients really oftentimes suffer tremendously from pain, the pain that really makes it hard to sleep, which is quite debilitating and impactful. The limitations of that type of injury, not being able to use your arm to raise your hand away from your body to do basic day-to-day things like getting dressed or brushing your teeth or putting away clean dishes into a cabinet. All of those, once you don't have the ability to do it, you really, realize what you've lost. And when the surgery goes well, we can improve all those things. So improve the patient's pain, improve the patient's function, and really improve the patient's quality of life. So that's one of the injuries and surgeries that I enjoy the most.
Wonderful, Ben. Thank you. And that brings me to last couple of questions. But I want to add ice hockey to rotator cuff. Is that true? I didn't bring that up, ice hockey, but that's a very aggressive game. People get injury a lot.
Yes, extremely aggressive because it combines sort of the fast pace like basketball, but then the collisions like football. Yeah. So it's an interesting mix. I would mention that ice hockey injuries would also include hip injuries. Injuries around the hip, like a tear of the labrum of the hip, can be quite limiting. And then we're seeing a lot more diagnosis of injuries to the core muscles. What used to be referred to as a sports hernia now the terminology is changing a little bit, and we're referring to those as core muscle injuries, and that can be, quite debilitating as well, especially if the diagnosis is delayed.
Well, Ben, you're giving me so many ideas for our future topics. I am so thankful. I mean, these are interesting topics, and I think we can talk 10, 20 minutes on each one of them several times, and it would be wealth of information for our patients. So I want to ask you first a couple of last questions. Number one, if you have any experience, any lesson of life to share that made you resilient, and that could help others who come after you.
Right. Yeah. I think I love the word that you use, resilience, especially, at this time when we're all facing a lot of different challenges. And I would like to just take a second to say, this series that you're doing, talking with your heroes is really inspiring to me. Thank you. So I know you get some personal gain because you get to talk to your friends and colleagues and get to know them better. But I have enjoyed the series as well. It's a great way to get to know people better, and just creates a more community environment.
Personal, deeper connection.
Yeah, thank you for that.
Thank you.
So I think that helps us all be more resilient. So I would say that from the standpoint of what helps me be stronger and more resilient, I think it's how we approach things mentally. That there's going to be challenges, there's going to be obstacles. Nothing's ever perfect, and we can look at that from different perspectives. But I'd like to look at it from the perspective of, okay, this is an opportunity for me to learn, to get better, so that the next time maybe this type of issue doesn't happen again, as opposed to being more pessimistic and just saying like, oh, I can't believe this is happening. This is terrible. I've got bad luck. I don't like to take that approach. So if we have the right mindset to, see opportunities when challenges arise, then I think we'll be more resilient.
Wonderful, Ben. I would like to ask a final question is, I have read in your CV and you're an orthopedic surgeon for some leagues in your area. And if somebody is looking for a surgeon like yours who is so down to earth, knowledgeable, has expertise and can serve their kids and their families, well, how can they find you?
Oh, yeah. Thank you. The easiest place to find me would be on the website. It's www.centralmontgomeryorthopedics. Orthopedics spelled with an E in the middle, no A, .com. So centralmontgomeryorthopedics.com. Our office is in Lansdale, within the LMG Medical Building, which is right in the middle of Lansdale, the corner of Allentown Road and Broad Street. Our address is 1011 South Broad Street in Lansdale, Pennsylvania, 19446, and our phone number is 215-361-5060.
Very nice. It's very prime location. It's right in the middle of Lansdale. I've been in this area. So, there are a lot of parents that I know and their kids, and, just seeing somebody, because I think one thing you would agree is seeing somebody like you to just get the education to have their kids learn how to avoid injury is also important. Don't you think that, waiting for the injury, so is there anything that you can do before even an injury happens? Like you said, non-surgical treatments?
Right. Yeah, that's a really good question, Farhan. I think injury prevention is important, but it's difficult. So if there is an injury, then I do think that some time needs to be spent during the treatment to also talk about what can be done to minimize the chance of something similar happening down the road. I would say the big concept that oftentimes I spend a lot of time emphasizing that is really critical for a lot of injury prevention is muscle flexibility. I see a lot of injuries that occur because as people exercise, as athletes, are participating in sports or training, there's a high emphasis on strength and endurance, cardiovascular fitness, and those are all important, but there is not an equal emphasis on improving flexibility. And without flexibility, there is a greater degree of injuries like muscle strains, muscle tears. We see a lot of inflammation, tendinitis that is generated because the tight muscles transmit much higher force onto the joint. So improving flexibility would be really helpful in minimizing or even completely preventing some of those injuries.
And I thank you so much for mentioning that. And I think that being a parent, I know that my kids would listen to somebody like you more because you could relate to them. You can talk to the language they need rather than me trying to explain. So I appreciate this opportunity for you to see people who can educate their kids the benefit of actually muscle flexibility and consulting you for those reasons too, not only wait until there is a major injury.
Yep.
That it could be prevented. So thank you so much, Ben, for your time. But we have to complete our next session, so don't go too far.
Yes, I'm looking forward to it.
Thank you.